I will now cover cardiac anatomy. This is a Cine MRI data set. I'm showing it to you in the axial plane, although it's a volumetric data set. So obviously here you can see the heart in the center of the screen beating away. I will follow the course of blood systematically through the cardiovascular system to highlight the anatomy. So let's just start with how blood is going to get into the heart. So it comes from the lower part of the body through the inferior vena cava. So here you see this venous structure here with slow flow. Next to it you see the aorta, which is an arterial structure that has higher flow. This inferior vena cava receives blood from the hepatic veins. So you can see these veins here. There's usually 3 of them that drain the liver. They come right into the inferior vena cava, or IVC for short, so inferior vena cava. As we come superiorly, you will see this inferior vena cava come right into the heart. So here now you see it's coming right into the heart, and this is the right atrium here. So this atrium, it receives blood from both the inferior vena cava as well, if we come superiorly, from the superior vena cava. Now the superior vena cava is also a vein, and this vein receives blood from the head and the arms. So between the inferior vena cava and the superior vena cava, almost the entirety of the blood that drains into the heart is coming through these vessels. So again, these come to the right atrium. Here you can see an atrial appendage anteriorly. So this is the right atrial appendage. That's part of the right atrium. Now this right atrium then has blood drained through it, and it goes right into the right ventricle. You can see here also a valve. This is the tricuspid valve, and in this particular case there's a little bit of a leak of that valve, so it's a regurgitating or leaking valve. But in any case, here's the right ventricle. The right ventricle node is usually anterior to the left ventricle. So just for reference, again, anteriorly here you can see the sternum in the anterior chest wall. Posteriorly you see a vertebral body and the spinal cord sitting in the spinal canal. So this is all posterior. And again, right is here, left is here, as we're looking at these medical images in standard convention, as if from the foot looking up towards the head. The right side of the body is on the left side of the image. So again, here's the right ventricle that's receiving blood from the right atrium. Now as we follow this, we will see that the blood then comes up through the right ventricular outflow tract and is now heading into the pulmonary artery. So here's pulmonary artery. You can see the blood coming out of it. Now note that if the blood came from the vena cava, inferior and superior, it's deoxygenated blood. This deoxygenated blood went through the right heart, in particular right atrium, right ventricle, and is now going out the pulmonary artery to the right pulmonary artery and the left pulmonary artery. These goes to the lungs. So here the blood gets oxygenated as it branches out from these pulmonary arteries all the way out from the right and left pulmonary artery to the lobar level. Say here, this is towards upper lobe, and then to the segmental level, all the way to capillary level. And then we have veins that drain the lungs. So these are the pulmonary veins. And so just for instance here, we can see in particular, I'm going to just draw your attention to one of the veins here that may be the most easy to follow as it's coming back to the heart. So for instance here, see a vein. So this vein is coming back to the heart, and you can see another vein here coming back to the heart. So these 2 veins are going to the left atrium. So remember, here was the right atrium with the right atrial appendage. Here's the left atrium with the left atrial appendage. In between the 2 atria is the interventricular septum. Now in this particular case, not all the pulmonary veins were going back to the left atrium. That's abnormal. I'm just going to focus on the normal anatomy in this case. So just for now, ignore the other veins that I'm not showing you. But here you can see the right inferior pulmonary vein, left inferior pulmonary vein, both going to left atrium. Now that the blood has gone through the lungs, it is oxygenated. And this oxygenated blood then goes from this left atrium into the left ventricle. So here's the left ventricle, and the valve that you see it passing through here is the mitral valve. So remember, on the right side, the valve was a tricuspid valve. On the left side of the heart, it's the mitral valve. This goes into the left ventricle. So here's the left ventricle. And notice that the left ventricle has muscle or myocardium that's much thicker than the right ventricle. So in normal individuals, that's always the case because the left-sided heart has to press against systemic pressure and pump against that. That's a much higher pressure than the pressure in the pulmonary side. And because of that, this is just a much stronger chamber, more muscle to pump against those systemic pressures. So now as blood has come in, it has to have a way out. And so if you'll follow here, we're going to come to the aorta. So this is the aortic valve right here. Notice that it's got 3 leaflets, just like the pulmonary valve. This is taking blood out of the left ventricle. It's now oxygenated, and then from the aorta, it goes through systemic arteries to all parts of the body. A couple of the arteries that come off right away are the coronary arteries. It's very hard to see, but there's one coronary coming off here. And then you have the ascending aorta. So this ascending aorta comes superior. I'll just show you right here. Here's the trachea. It's hard to see, but this is the trachea. The aorta is on the left side of the trachea as it forms the aortic arch. And then off of that arch, there's usually 3 vessels. So you'll see 1, 2, and 3. So this is the innominate artery. This is the left common carotid artery, and this is the subclavian artery. So again, as you come off the aortic arch, as we come superior, you can see these 3 vessels coming off. Now, one of the things that may be a little bit easier for you to see also is the anatomy as it's in the coronal plane. So I showed you a lot of the anatomy that was in the axial plane, but maybe just quickly what I'll do is just highlight some of this anatomy that's in the coronal plane. So I'm just going to try to get this oriented correctly. Let's see right here. Okay, so here we now again have left side of the heart here, or left ventricle, off to the left side of the patient. So now it's oriented correctly. So again, here's that inferior vena cava carrying blood up into the right atrium. Again, inferior vena cava receiving hepatic veins. And then this is the right atrium. So right here, see the right atrium and the superior vena cava coming down here. Then we go through the tricuspid valve. Now we come into the right ventricle as it's coming in and out of the screen here. Right ventricle. So again, right ventricle. Out here is the right atrium. The right atrial appendage is here. And then the blood leaves the right ventricle through the right ventricular outflow tract to the pulmonary artery going through the pulmonary valve. That artery then goes towards right and left sides. Here's the right side, left side. The veins then come back. So here you can see blood coming back, and in particular can show the direction of flow here. So here you see the blood going out of the heart, out into the lungs, and then you see here in this vein, the blood is headed back into the left atrium and through the mitral valve into the left ventricle. And then from the left ventricle, we will see the blood that's heading through the aortic valve. So here's the aorta. And then we'll see the blood flowing again out. So here you can see it flowing out the aorta through the arch. And then those 3 arch vessels that I mentioned before. So here's that left subclavian as the last of the 3rd arch vessels. And then the descending aorta heading inferiorly. So that's in 2 planes, the cardiac anatomy that is shown through an MRI.